Hi, everybody. My name is Joe Wicklund. I'm the Communications and Community Engagement Manager for the City of Hermantown. We don't get a lot of questions at City Hall about insurance, probably for a lot of good reasons, but they do over at our partners at the Essential Wellness Center, and there's some pretty good reasons for that because we have a not as well known as it should be embedded resource over there in Michelle Babcock. And so today we're going to talk a little bit about MNsure and insurance. Hi, Michelle.
Hi, Joe. Thanks for having me today.
Yeah, so you and I met before, and we've talked a little bit about a variety of things, and we want to kind of clue folks into more of the resources and opportunities that are happening over at the Essential Wellness Center through a grant through the YMCA and the work you're doing over there. So tell me a little bit about who you are, and we'll get into why folks should hang out with you.
That sounds great. So, like Joe said, I'm Michelle. I'm here at the Essential Wellness Center. I'm a MNsure Navigator, and I know that that's kind of an arbitrary term for many people, but what a MNsure Navigator does is works with consumers to help them find adequate insurance. Some people may not have insurance, or you may have insurance, but it's not the right fit for your current situation. So that's what we're here for, is to kind of solve that puzzle and make sure everybody's on the right path.
So kind of that first like stereotype of thing that you've got to get rid of is, Michelle, you do not sell insurance, do you?
Exactly. I do not sell insurance. We are a free service that assists the public. So anybody in Minnesota can work with a MNsure Navigator.
So I'm kind of like literally kind of the average Joe, or even the below average Joe, when it comes to knowing about how insurance works. So when we think about like the why part of someone coming to meet with you, that, hey, I'm not going to be sold insurance by Michelle. All right, I've seen this video. That's clear to me too. But why would I connect with her? Why would I call her? Why would I set up a Zoom call? Why would I come hang out with her?
Great question. So as a MNsure Navigator, we can assist with anyone regarding open enrollment, which is actually now open enrollment in the state of Minnesota for health insurance started November 1st, and it goes through December 22nd. So we help people apply for a MNsure account, apply for the insurance itself. We help people with their life event changes and everything from, there's 3 different buckets of service that, or coverage, I should say, that MNsure has. They have Minnesota Medicaid, or the Medical Assistance Program, Minnesota Care, and also private healthcare plans called QHPs. So we are versed and knowledgeable in all 3 of those programs and can make sure that whoever the individual or the family that's applying has the adequate coverage based off their family situation and their needs.
So not only am I not an insurance expert, so part of what I hear you saying, Michelle, is you can be my insurance expert for me. You can help me literally navigate through all that stuff.
Absolutely. The only thing that MNsure Navigators can't do is recommend any plans. If you're on a private healthcare plan, we're not brokers. We can't recommend which plan you go through, but we can give you all the information to get you going to make those decisions.
So the idea is, you've got somebody there to help you. They are free. It doesn't cost anything to meet with you except for some time. The potential exists that as I kind of walk through this experience with you, I might save some money, have a better idea on how to get myself covered. Obviously, I'm going to be able to maybe learn some things about positively impacting my health. So we're talking about free, saving money, improved health. Why wouldn't somebody come and carve out some time with you?
I can't think of a good reason. I mean, we're here as a resource. Even if you're just looking for information, if you just have questions on the process, we're here for that as well. That's all part of it. I mean, there's people that come in and maybe they don't have insurance and they leave the appointment signed up for insurance. Maybe we have an hour-long conversation and everything in between. So really, I mean, just a good resource to have. And we're just wanting everyone to know that whether it's the city of Duluth, city of Hermantown, surrounding areas, there's navigators available, not just even here at the Essential Wellness Center. If you look on insureduluth.org, you'll find a list of community resources, trusted organizations that have navigators that might fit more of a geographical need for you. I know right now we're doing remote help, so people can do their entire enrollment by the phone, which is perfect for this pandemic time. And we also can do in-person appointments if necessary, following safety protocols.
So we've covered a little bit of who you are and why, it's a great option. There's the how piece, which is, you've covered this a little bit, but, so if a person wants to connect with you, what's the best plan? And also, I mean, you deal with folks on a regular basis all day long. So you've got folks who are stuck in the 9 to 5. You've got folks that are juggling 3 jobs or 3 kids or crazy schedules. And not only are they not insurance experts, but they're never going to have time to meet with you. How do I get in touch with you, and how do I navigate my schedule to fit with you?
Oh, I'm so glad you asked that. Perfect question. So you can call me anytime. I'm here at the Essential Wellness Center, and you can also email me. I can get you my information. Maybe Joe, you could put that up so people could link that. That'd be great. My availability is really based on consumers. If somebody needs a 5 o'clock appointment, I'm available for that. Between now and December 22nd, I'm available Monday through Saturdays. Certainly not available 24 hours a day, but again, I'm flexible. I want to be able to be available when you're available. So call me, we'll set an appointment. Most appointments take between 60 and 90 minutes for an actual enrollment. But I'm here available whenever needed.
And some of that time frame is simply, figuring out, you taking some time to figure out an individual or a family situation to be able to start kind of guiding them, right?
Absolutely. I mean, the things that we're going to be asked, it's kind of a screening process, if you will. We have to ask some, mandatory questions to know, what program you would be qualified for, what you could fit in for. And so having your income available, having possible last year taxes available, having social security numbers of people who are applying available, those are the things that people should be prepared for. And sometimes there's a follow-up call needed. Sometimes we can get it done in one fell swoop.
When I think about probably the basic kind of questions that you probably get asked regularly, and they're probably not even questions, right? The biggest statement you probably get is and folks are probably saying this now, even before they get to you, is, I don't qualify for MNsure. So I don't need to talk to Michelle because I don't qualify for MNsure. But that's not really the right starting point for this, is it?
No, it's not at all. So MNsure is the platform. It's the marketplace. MNsure has 3 different, I call them buckets of coverage. There's those 3 different programs. And it doesn't matter your income. It doesn't matter your family size. There's a program, there's a coverage for you if you are in need of coverage.
Cool. And then the other part, I would imagine too, you mentioned obviously all the changes that we're dealing with coronavirus, but also some of the regular occurrences. It's open enrollment. It's that time of year. We're talking about, folks who, job changes, job losses, marriages, family size changes. There's just a lot of variables that are always in the mix, and now they're multiplied by the coronavirus. I think sometimes, at least personally, I feel like sometimes you make a decision this time of year that you feel stuck in. I'm stuck in my insurance. So that's the other thing that came up. Not only, hey, I don't qualify for MNsure, as you've kind of covered, but like, I don't want to be stuck. What's your kind of response to folks who feel like that this time of year?
Yeah, so MNsure requires that everybody report changes. This has to do with anything as simple as an address change to a life event change, such as a marriage or a child. This would be income changes, job changes. So they're always looking at your situation and making sure to put you in a new program if that's what's appropriate. So not only is it required to put your changes, you really want to do that, but it's also beneficial to the consumer to do that and keep on top of that real current live information.
So the I don't qualify parts and the, I don't want to be stuck in a 2021 that I don't know what'll happen are you can kind of dispel those, and it's still worth kind of connecting with Michelle for sure.
Yes, absolutely.
The last piece, you and I have talked, we're gonna cover, in future conversations later this week about stereotypes and different things that you deal with, but there's a reason why we're having this discussion, and it isn't just because, hey, the YMCA at the Essential Wellness Center got a grant and Michelle's there and she's fantastic. This is a real need in our area. And I think whether we're talking about the city of Hermantown, where I work, or even the surrounding areas, whether we're talking about some of the small townships or spilling all the way into Duluth, and I'm learning this from you, we're a really kind of dramatically underinsured area.
Yes, there's some numbers we were able to get from Generations Healthcare Initiatives, and the numbers really do show that there's some underinsured populations here, right in this Hermantown and surrounding areas. There's, just a huge need. I mean, if you don't have health insurance, one event could really, break you. It's such a hard thing to go through, a medical event. So you really want to be prepared, and you want to have all of your resources. We encourage anyone who is uninsured or underinsured to give a call, or even if you just want to call and review your situation. Again, we're not selling insurance. I can't recommend an insurance plan. What I can do is say, this is what I'm finding based on your situation to get you the best appropriate coverage. And doing that for everyone in the Hermantown area, Duluth area, surrounding communities, that is definitely the goal, to get those numbers up.
That's exciting. I know, a lot of folks aren't necessarily knowledgeable on the relationship between the city of Hermantown and the Essential Wellness Center and how that all came to be, but it really is a regional center for health and more. And that is a big part about why you and I are discussing what we're talking about today, but also the idea that this extends beyond certainly the borders of one particular city. This is definitely not just a Hermantown thing or a Duluth thing, but something that we can all talk about, because in some capacities, we're going to dispel some myths about MNsure insurance, what your role is in it, but also maybe bring in kind of an under-discussed part of healthcare to the surface, so that we can even in coming discussions talk about, where you could do some neighborly things to reach out to some other folks to kind of guide them to Michelle. So it's not just you and I talking about it, but there can be, at least during this open enrollment period, during a really kind of chaotic and dynamic time because of coronavirus, more discussion about some basic pieces that we don't, like I said at the beginning, I don't need to be an expert in. I just need to know where to go to get your expertise.
Yes, absolutely. I think just having that resource here, having people know that we're here, insureduluth.org, there's other navigators as well. I mean, we're all here to reach out and educate and inform people, and then hopefully the word will spread and we can serve more in the community.
That's fantastic. Michelle, I want to thank you for your time today. Michelle and I are going to get together. We're going to do a couple more kind of versions of this. We're going to put some information out for folks to chew on and to consider, both on the City of Hermantown social media websites, a little bit through the Essential Wellness Center's sites, and we'll kind of base this off of the City of Hermantown's personal city website. But also the idea is this is all information that's out there for folks to be able to grab and to chew on and find different ways to connect with Michelle. So as folks are seeing this, hit that share button, talk to your friends and neighbors about it. The goal here is less about, kind of Michelle and I building awareness, but really being able to take that awareness a step further and see what's possible with it. So in future discussions, Michelle, we'll have some awesome candid discussions about the who's, how's, whys of insurance. And the entire time, I hope to not gain expertise, not become smarter about it, so that we can just keep you as the expert and spread it out to everybody who's in the same boat as me, which is, honestly, kind of intimidated by insurance and intimidated by open enrollment in this time of year. These are important decisions, and it's awesome to know that there's somebody like you out there that we can reach out to. So thanks for your time, Michelle.
Thank you, Joe.
All right. Stay tuned, folks. There'll be more. We're excited to talk about MNsure insurance, get to know Michelle more, and get to know more about the opportunities that exist to support our area and becoming a little bit more insured and a little bit more coverage in terms of be able to improve our health prospects in our area. Thanks, everybody.